Do you have any individual success stories that you would like to share with us? Maybe a one that started out being difficult and then, turned out to be a success that was not so easy to do?
Well, our acne patients, whether it be adolescent acne or 20s and 30s, when you're going through, all of a sudden women, menstrual cycles, pregnancy, post-pregnancy, menopause, cancer patients going through different treatments, hormonal changes, acne. I think if any provider can get their arms around acne and learn how to, you're not going to cure it because there's not a cure for acne, but if you can learn how to manage it, mitigate it, and keep it from becoming worse, because we all know, most of us dealt with acne at some point in our teenage years, and what you don't want to have happen is you don't want acne to become a social stigma. So in these teenage years, when these adolescents are developing, they're gaining their self-confidence, and they're in a very vulnerable state in their development. I think we, and this is something I've thought a lot about, many times, and even healthcare professionals, their own children, they're in their own world, and they know it's coming because the hormones start changing 12, 13, 14, 15. And most people are seeing somebody that they trust with their care. So maybe the parents are getting facials at a place. I think we as providers should be proactive and try to make sure we're educating the parents before the storm comes so we can prepare for the storm. And if we do that ahead of time, then maybe we can save that child, that adolescent, from getting what could otherwise be a big stigma and maybe a self-confidence thing for them through their junior and high school years. So if we can get ahead of it, teach them a good routine, mitigate the severity of the outcome, and that's what I've strived to do, and that's where I think we've really been able to blend the Is Clinical products into our treatment protocol for acne. Now, we don't always get that opportunity because now we got somebody that's in the middle of severe acne, and what do we do with that? So maybe now we got to pull out a prescription for tretinoin. I don't know your thoughts on this, but I feel like when I hear patients that say they went to the dermatologist and they wrote them a script for Accutane, I think about oh my gosh, we could have done so much more before that.
What could we have done first?
Yes,
because on Accutane you will have some side effects, everyone does, yeah. And it isn't that Accutane's a bad medicine. No. There certainly is a place for Accutane, but what could we have done first that was maybe less invasive?
Yeah, and there's a lot of collateral damage. So I made this analogy one time that, if you get flies in your kitchen, on your kitchen countertop, it's kind of like going and grabbing the shotgun to kill the flies. You might kill the flies, but you could do a lot of collateral damage. There's a lot of things we could have done to avoid the fly problem. So kind of like acne, if we know it's coming, what can we do to clean the skin, treat the skin, and prevent it from getting worse? And that might be a multi-product or treatment, multi-faceted plan that may include oral, systemic antibiotics, topical antibiotics. But start in the beginning and then pull out the bigger guns as you need them.
And you're right, acne is a very destructive process, and not only to the skin. We both know that individuals who have had acne, even if it clears up, that their life can be changed forever from that. Yeah. They have less successful relationships. They don't make as much money at work as people who did not have acne. They have more depression. They have more incidences of suicide. It's really unfortunate what happens to the emotional toll of individuals who experience acne outbreaks. And another thing, this is an unfortunate comment on kind of what's happening in medicine now, but many times if those individuals are just only seeing the regular medical professional, they're gotten very well through the acne regimen, but then and then they got better, but they've not been helped in terms of how do I care for my skin? How do I feel better about myself emotionally? And one thing that I've learned being, since we started as clinical, is that when they see the esthetician and they come to practices like yours, more of that health and wellness conversation goes on, and they come out of the acne regimen and emotionally they are healthier, so they're more successful in life.
Absolutely. And that's just part and parcel to why I do what I do and why I love doing what I do. So, you're right. We're a little unique. People want to ask, well, what specialist are you? Are you an internal medicine?
And what do you say?
It's like,
I did that, but now I do.
I've helped more people as what you might say is supposed to be a primary care provider, because as a physician, I'm supposed to help people. So without pharmaceutical medications, I've helped more people reverse their diabetes, their blood pressure, their cholesterol, all these conditions that are Western medicine, and I'm not knocking it. There's a lot of great things, and we have one of the best healthcare medical access systems in the world. And there's times where, hey, I need a knee replacement. I need to go to the best knee surgeon. So we have amazing medicine and amazing technology. But I think sometimes where we're still missing the boat is we call preventative medicine, but what does that really look like? What is that? Well, preventative medicine is having the conversations at the right time and having the right education to make sure that people can either avoid or hopefully reverse their condition. And we do that through the IS clinical product line that you guys have done such a great job to develop.
You're right. Prevention is so much better than treatment, because if somebody has a, let's say, a disease process or a condition already, and you're treating them, you're already behind. If they don't have that condition yet, and you're before that and preventing it, you're ahead. Yeah. Now, what you say is also true in terms of educating the patient. They may come to you and they don't know they're in that sort of warning or danger period before they develop the condition or the disease. And so it's important to educate them about risk factors or lifestyle things or what they're doing that is important in prevention, and saying, if we prevent this, we can extend your health span. It means you're happier, you have a better life.